So, hello everyone. I am with Dr. Sanjay Sharma today, and we will be talking a lot about digital health and aspects to it. So, first of all, how are you, sir?
Pretty well.
You're
How
doing
about
great.
you? Doing
All
good.
sir,
Doing good.
doing all good. Sitting next to you feels great, right? I can feel that vibe from you. So, primarily, I would like to tell you that Dr. Sanjay Sharma is a podiatric surgeon. So, I have heard of pediatric surgeon. I have heard of other surgeons as well. But, sir, what is a podiatric surgeon first of all?
Podiatry relates to foot and ankle,
Right.
and it is important because about 25% of the bones
Mhm.
of our body bones, 206 bones, and 25% of them are in the foot.
Right.
There are about 119 ligaments in each feet, and about 33 joints in each feet, and
Right.
this makes it a more complex structure in the whole body.
Right.
And it requires a dedicated branch of medicine for it to deal with.
Right.
If you're looking at US or UK, South Africa, Australia, and those countries, they have a bachelor's degree in podiatry,
Okay.
and then do specializations and super specializations in podiatry.
Right.
But whereas, as you said rightly, it's about people in India think that it's pediatrics
Right.
rather than podiatry. And even when I completed my fellowship in podiatry and came back to India and talked to my own classmates who are doctors,
Right.
practicing doctors, they always thought that I was spelling it wrongly, and I would have completed a pediatric surgery and telling it as podiatry
Right.
rather, and I had to correct them time and again, saying that no, it's not pediatrics and it's podiatric surgery. And even today, people get some kids looking at my profile and saying that okay, he needs a surgery, which I say that was I'm looking at the foot and ankle
Right.
and not the pediatrics of a kid.
Right. That's great to learn because I also thought that initially you might have a wrong pronunciation towards it or something like that. Right. But later on, I got to know from you only that what is podiatric exactly. So, sir, you also are associated with your own startup that is FootSecure. So, what is it exactly? What does FootSecure does and how does you integrate technology into this foot mechanisms and all these things?
So, as I said, podiatry is about foot and ankle.
Right.
We do not have in India a comprehensive hospitals or clinics dedicated to foot and ankle.
Right.
We have podiatry practice very rampant as dentistry is practiced in India. Similarly, podiatry is being practiced in the Western countries,
Right.
so as to say, including South Africa, Australia, and other things. But in India or South Asia lacks that system itself. And
Right.
FootSecure was started to provide a comprehensive care for the foot and ankle.
Okay.
It can be, I would put it into three buckets for the foot and ankle.
Right.
One would be the drastic impacts that we have as a diabetic foot, where it leads to amputations.
Right.
And we can talk about the statistics later.
Right.
The second bucket is various sports injuries or sports performance enhancement.
Right.
I would call it as a shoe doping.
Shoe doping.
Yeah, where we can increase the performance of a sports person by providing the right footwear, a right insoles, a customized insoles for the
Right.
patient and other things, and also prevent the injuries that happens to the sports people.
Right.
So that's the second bucket. And the third one is the most common, where we have a foot pain, heel pain, front foot pain, and other things, and where people generally go to an orthopedist,
Right.
and he sees the X-ray or the MRI and says nothing is wrong, take physiotherapy or take some analgesics, where most of them fail to look at how is their walking gait and how is their posture, how are they
Right.
standing, what kind of a footwear are they using, and are those things causing the pain in the feet.
Right.
And that's something that we would want to address. So anything for the foot and ankle, from
Right.
starting from the basic nail care, where a geriatric patients cannot bend and cut their nails,
Right.
to Biloni, ebony amputations or vascular surgeries is
Right.
something that we deal with in FootSecure.
Right. So you are majorly also using biomechanics in this.
Yes.
Right. So if I talk to you about like this further, you said something about diabetic foot. I've heard of diabetic foot ulcers earlier also, but what is it exactly, and how we are playing a role in this basically? Since I've heard about ulcers, once you get them, people have to amputate them, right? So what is the exact role that you're playing in this?
So, yep, rightly said, diabetic foot is supposedly the next epidemic that is happening.
Right.
Every 20 seconds, a limb is lost due to diabetes
Right.
somewhere in the globe.
Right.
India itself has about 14 lakh amputations that happen every year.
14 lakh.
Every year due to diabetes. And the mortality rate post amputations is about 70%.
70%.
Yeah,
That's a huge rate, sir.
5-year mortality rate post amputation is 70%, which is higher than cancer.
If we are talking about 14 lakh people, it is more than 8 lakh people who are getting died because of this.
Yes. So and there is absolutely no awareness about it. People are talking about cancer, heart attacks, and other things, but this is something where the mortality rate is higher than cancer.
Right.
And there is absolutely no awareness of what to do and what to take care of.
Right.
And these amputations 80% of them can be prevented
Right.
by an early and right intervention.
Right.
And if you say 80% of them can be prevented and so many lives can be saved. And that is where we are trying to intervene from the diabetic foot, from the FootSecure perspective, where we trying to save amputations because of the diabetic foot ulcers or because of the diabetic foot. Just to give a statistics, the India average of diabetic foot amputations is about 19%,
Okay.
and we are only at about 2%
Right.
from the last 4 years that we have been.
Right.
How we're doing it is to ensure that amputation is not the final panacea.
Right.
Because an amputation is done, a toe amputation is done, the next toe will get an ulcer.
Right.
If that toe gets an, I think it's a series. It's like,
It's a series.
until you go to a below knee amputation, it keeps on getting one after the other,
Right.
the other.
Right.
And it's important to see what is causing the gangrene or the infection in first place, and then intervene at that point of time. Not only in the wound care, even before the wound happens.
Right.
If we can do some diagnostic tests in terms of the biomechanics, as you mentioned,
Right.
how much pressure is putting on the feet, what is causing his feet to get an ulcer,
Right.
and then intervene with the right footwear or a right insoles, that
Right.
itself will prevent an ulcer and prevent an amputation.
Right.
And even if the ulcer is present, how do we treat it?
Right.
And how do we ensure that the wound heals early rather than keeping on dressing for months together?
Right.
And ensure that the wound heals within 12 weeks. 4 weeks is any wound would take to heal typically.
Right.
And today in India, average of a wound healing is about 52 weeks.
Right.
Or even
Which is a complete
couple of
year.
months.
Which is a complete year.
So we would want to look at how we can manage it in 12 weeks and do all the interventions. It could be
Right.
digital, non-digital,
Right.
physical interventions, everything to ensure that the wound heals in 12 weeks.
But as as we were speaking earlier about 4D bioprinting, so how you are applying that to heal the foot faster?
So once there is a clean wound for a dermis or epidermis to grow over it, it takes time.
Right.
People generally, you go for a skin.
Sir, I would stop you for a moment. Our audience doesn't know about wound care and wound management. If you can first of all tell them about this and then start with the 4D bioprinting, that would be great.
So wounds are every wound in terms of if you fall while having a kid, you will have a small scratch or a laceration or something like that. That is a wound.
Right.
A surgical incision is a wound, or any skin disruption where the skin is not properly formed is called as a wound.
Right.
And each wound is different. It's not that every wound is the same and you can treat every wound the same way. Each wound is different. And for each person, it takes its own time, and the mechanism to wound to heal is different. And as and when you grow older and have these chronic conditions, it could be a liver condition or diabetes or varicose veins or vascular conditions.
Right.
The wound healing gets more complex and complex. Unlike when you were a kid, where it used to fall and within 3-4 days it is healed.
Right.
But it takes years and years for a chronic ulcer to heal.
Right.
And it has various mechanisms in it where it gets stuck, and we need to ensure that it keeps on growing. And for any wound to heal, blood is most important.
Right.
So the blood needs to be flowing into the wound for it to heal.
Right.
So I don't want to get into a medical part of classifying the wound and other things, but let's understand that chronic wounds takes a very long time, possibly years together for it to heal. I have seen patients where they've been dressing the wound for 15 years, 17 years.
That's a very long time.
Yeah. So, and we need a different approach for wound care and wound healing.
Right. And as we were talking about 4D.
Yeah. So the wound could be in different stages. First, just to understand, it could be if it is a chronic wound, it could be with no infection, and then it could be with infection, and where there could be a vascular compromise, in the sense the blood is not coming into the wound itself.
Right.
So we need to address the primary cause of it. Is it a pressure that is causing the wound, or is it any other internal issues that is causing the wound?
Right.
And then based on that, we need to kind of take this thing. So let's think that the wound is non-infected, or infection was there and it's completely healed. It's a large wound where the skin cannot grow itself, or it takes a long time for the skin to grow.
Right.
And in those cases, what we do is something called as a stem cell therapy or regenerative medicine, which is in vogue today, where instead of doing a skin graft, we're taking a skin from the other place, from the thigh or somewhere else, and put it onto the wound, or doing a flap. We just make a small port into the abdomen or into the thigh, which is like less than 2 mm port, and then take your about 20 to 30 ml of fat,
right,
and then analyze the wound using an AI module in terms of what is the depth of the wound, what is the size of the wound, and other things,
right,
and then 3D print this fat, process it, ensure that it forms like a gel kind of a structure, 3D print it, and then put it onto the wound. We're calling it as 4D printing because the time also comes in. We need to understand how the 3D printed product,
right,
or the fat cell, the ECM,
right,
behaves after putting onto the wound.
Right.
So that's the time frame that we are looking at.
Right.
It is the fourth dimension. So
fourth variable in it. You can
fourth
say,
variable. So because it is a bioink.
Right.
It degrades. It kind of gets absorbed into the body.
Right.
It has other effects also around the wound.
Right.
Unlike an innate object where you have a 3D print and keep it on the table.
Right.
So when the time is taken into consideration, it becomes a 4D bioprint, and then we place it on the wound. It works on the concept of regenerative medicine or a stem cell therapy. It is not fat transplant,
right,
but it's a stem cell therapy where the mesenchymal cells in the fat tissues or the epithelial stem cells in the fat tissue triggers the growth factor within the wound, and also triggers angiogenesis in the wound,
right,
and helps the wound to close in faster,
heal faster,
yeah, wherein we prevent further infections.
Right.
We typically heal it within 12 weeks.
Right. So you also talked about an AI algorithm which you are already practicing in your organization. So is this AI algorithm in-house? You have trained it yourself? You have put the data yourself, or have you hired someone else to do that?
It's in-house.
It's in-house.
In-house.
So how precise is your AI, first of all? Because I have heard of AIs many places. Somewhere it is precise, somewhere it is not. So how precise is your AI? Because it is related to patient care, right? It has to be 100% precise, or 99 at least, right, to be up to that level.
So I would say it's work in progress. It cannot be all done. AI is always a work in progress.
Right. It's always evaluating.
Yeah. More data you put in, the more accurate it becomes.
Right.
So from the sizing of the wound perspective, we are at 96%.
Right.
But characterizing the wound in terms of where we are facing challenges is the texture and the shape.
Right.
Shape not in the sense of the shape that you see in the 2D image,
right,
but shape in a 3D aspect,
right,
like the depth and then the curvatures.
Like
and
an MRI scan would do that, an X-ray wouldn't.
Yes. Okay. So that shape is something that we are facing a challenge,
right,
and we would want to keep it simple. We don't want to give gadgets to the doctors to document it.
Right.
We want to keep it simple, where his simple mobile phone that he has should be able to give us the shape, texture,
right,
color, and the sizing.
Right.
So sizing, we have perfected it.
Right.
Color, we are almost at about 86% accuracy in terms of, which can say whether it is a necrotic tissue, whether this is a granulating tissue, whether it's a sloughy tissue. But shape and texture, we are still at about 60-65%
right,
accuracy,
right,
which is evolving. So as and when
as the machine learns more, it will take better decisions, right?
Better decisions.
Right. So this is all. And the last question that I would like to ask you is, first of all, why podiatry? And second question is, one advice if you like to give to our young innovators on screen, what would it be?
Why podiatry? It's an unmet need. As I gave the stats, there is absolutely hardly about qualified podiatric surgeons in India are hardly about 50 to 70
right,
across India, and
right,
all of them who have trained abroad and come back and settled back in India,
Right.
and it's a very niche segment, and where we have a huge impact on the people.
Right.
It could be wellness, it could be diabetic foot care,
Right.
or varicosities and other things. Impact and niche is
Right.
why I chose podiatry.
Right.
And the message I would say is, if you, whatever could be your passion, if you pursue it, it will pay off. Might be initial times there might be struggle, there might be setbacks, but surely, passion always pays.
So guys, it was nice time with Dr. Sanjay here, and do remember this: nowadays or now onwards, if you get any kind of injury in your foot or ankle, do visit a podiatrician, podiatrician instead of visiting a orthopedist, right? Because the time is evolving, we also have to evolve accordingly. If there's a specialist who has particularly practiced in the particular field, we must go to him for precision medicine as well, right? So thank you, Mr. Sanjay, for being here with us, and thank you. It was lovely time speaking to you.
Pleasure. Thank you so much.
Thank you.
So much.
Stay healthy.